But in fact, you're actually doing more harm than good in the lower back when you're doing that kind of stretching. So you focus on rebuilding stability for that lower back to protect it from further injury rather than trying to stretch your way out of it. Jibby has said, should I push for an MRI? Um, Comments on MRI. Number one, we have a full podcast episode. So send us a DM after this, Jibby. We'll send you a link to that episode of the podcast. Because fundamentally, I think imaging is really, really helpful. So if I use the example of me, my knee, I injured my neck a number of years ago, and straight away went over to the clinic. Now I have the flexibility. I did an X-ray straight away there and then. I didn't have to wait for anyone else to do it to see what was going on. And with my knee the other month, I got the MRI done within a week. I think doing the imaging is helpful. It does not change the rehabilitation work that's needed. And so often, people that have that leg stiffness, they're trying to do stretching over and over again. Then 6 months down the line, a year down the line, they get the MRI and they're like, "Oh, it's a disc bulge." Like, why don't you just treat it as a disc bulge now anyway? Treat it as a disc bulge. Assume it is a disc injury to the lower lumbar spine, L4-5 and L5-S1, because basically you did it when you were bent over like this, or something to that effect. And then treat it as if that's the case. Focus on spine stability stuff, and you'll get better. And then, by the way, you get the MRI later on, right? And you're like, oh, great, yeah, okay, that makes sense. That makes sense that I've got a disc bulge, and that's what makes sense why I'm in pain, but I'm already feeling better. And that's not to say you stop your rehab, right? One of the big mistakes people make is thinking they feel better, the pain is gone, and thinking that means that they are better. Those are two very different things.